So, hi everyone, my name is Dr. Akram Ahmed. So, I'm basically a Indian pharmacist and I'm a PhD graduate. So, I'm basically a lecturer for clinical pharmacology for pharmacy and medical students here in Australia. So, I'm last 6 years, I'm basically trying to create the awareness among the healthcare professionals, especially in the Indian subcontinent, to migrate to Australia. So, today we are going to discuss opportunities for you in Australia and regarding this ADC exam. What are the steps need to take and visa, jobs, each and everything we are going to cover. If you have any specific questions to me, so please you can ask me at the end of this webinar. So the webinar is very short and crisp, basically I can see, but then it's like a more interactive session. Okay, so you can ask me any questions you have regarding dentistry in Australia. Okay. So, Academically is a Australian ad tech, and we provide assistance for all healthcare professionals like medical doctors for AMC, dentists for ADC, pharmacists for CAP, AIMS for lab technicians, and NCLEX for nurses. So all these exams basically, and APC for physiotherapists. So we basically provide assistance to complete A to Z documentation process and pass the exam, English exam, and so it can easily you can migrate to your home country to Australia. This is a little bit about me. So I'm basically a pharmacy professional earlier. So I work earlier in India, then I moved to Malaysia where I work around 4 years. And last 6 years I'm living and working in Australia. So basically in India I work only hardly 4 months as an assistant professor. Then I moved to Malaysia. So my basically the experience in overseas, and so I'm guiding all the students. So basically, the clinical pharmacology is my subject, and I'm one of the leading the researcher in this field. These are some of the faculties for this ADC program. So the scope of dentistry you can basically understand in Australia just from this article. So recently, this article published in one of the leading newspaper in Australia. So Australian men save 85,000 by flying to India for dental treatment. So the treatment is very costly in Australia. Because there is a huge gap for the dentist they need in Australia. So especially in the rural area or regional area and growing geriatric population in Australia, so they also need more dentists in Australia. So the cost of the treatment in Australia is very high. So you can see this guy is an Australian patient. So he went fly to India and he did treatment. He stayed at a 4-star hotel and all those like 2 weeks he was in India. So he just spent only 15,000 AUD, around 8 lakh Indian rupees, and he came back to Australia. Otherwise, he has to pay 100,000 bill, means around 55 lakh rupees the treatment in Australia cost, and in India, hardly the cost for 2 to 3 lakh only. So the very cheap in India and in Australia very expensive because even if there is a small treatment I need to basically wait for like a week or something to meet my dentist. So this is a situation in Australia. They need a lot of dentists in Australia for practice. So opportunities in Australia for dentists. Australia basically provide 190,000 permanent visa, PR visa, basically, if you are looking to market Australia. And there is a website called seek.com.au. This is the #1 website in Australia for job searching. This is similar in India. We can say like job Naukri.com is one of the famous job portal in India. So if you go, I just type on this in their basically portal. So currently these are the advertisement are available in Australia, 2,242, and they are showing next 5 years 28% around the growth in the job market for a dentist. They need more dentists basically for next 5 years in Australia, and the Australian salary on an average 180,000 Australian dollars is going to be around 1 CR per year salary for a general dentist in Australia. And job satisfaction is very high. You can see here, out of 40.9, they are based on the reviews from the dentist. So in Australia, a lot of vacancies are available, and job growth for next 5 years is predicted around 28%, and salary is very high. So you must think to about to migrate in high income countries such as Australia. I know many dentists personally are struggling in India, especially the young dentists are not getting jobs, or the salary is very very low, like 15,000, 20,000 rupees they are getting when they start their first job after they graduate dentistry. Or and dentistry very very costly in India, around 30 to 50 lakh rupees you have to pay, especially in the private medical colleges and dentistry colleges you have to pay. And after that 30 40 lakhs you invest in your degree and you are getting 20,000 rupees salary, so this is not justifiable. So Australia, I can say, one of the best country at the time to migrate as a dentist in Australia. So there are some other benefits apart from these. So in Australia, the education for kids are free. So in India, the parents basically they save the money for their kids' education. They have to pay. They want to send their kids in the private school, good schools. They have to pay for this. A lot of things. But in Australia, it is free. No need to worry. Government will take care of all this. In India, we have to be like, we have to buy some insurance, or we have to be like, we have to save some money if something happened to in your family. But in Australia, healthcare is free. There's a universal health coverage in Australia. Even in US, you need to buy insurance to cover your health in US. But in Australia, there's a universal health coverage from the government. So no need to buy anything. It is free for all, for your whole family. And professional development. You are working as a dentist, any clinic or any hospital, and now you want to do some course, maybe online course, maybe you want to run any workshop, webinar, or you want to present any paper in conference. So these are the highly encouraged in Australian system, and they will pay all these job bills. And work-life balance, this is very very in terms of, in India as a dentist, might be you are working 12-hour shift, maybe 15 hours is very very common in Indian scenario. 10 to 12 hours very 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 common. But in Australia, you have to work 38 to 40 hours weekly, means 8 hours maximum per day for 5 days you have to work. Just the salary I mentioned, this is for 5 days work, not 6 days. If you are working 6 days, or maybe you are working after hours, you will get extra paid for that. And the opportunity is very high. As mentioned, around 200 advertisement right now. They are looking for the dentist, and quality of life is obviously a high, excellent healthcare, diverse culture here, and a lot of Indians nowadays migrate to Australia. High potential earning. This is once year on average, any dentist will anyhow you will earn if you migrate to Australia and complete all this process. So what are the steps you need to complete in order to migrate to Australia? The first step we call initial skill assessment with ADC, Australian Dental Council. Okay, so no need to worry. We will help you to complete this process. This is not something I know. This is a step one process. So basically, wherever you want to migrate, whether it is US, even a small country like Dubai or Saudi Arabia, in this country also you have to do like data flow or documentation process. So the first step to any country is literally document verification, and we will help you to complete it. The next step, you have to write this ADC exam. This is an online exam you can write in your home country. Okay, and we will provide you the 4 month coaching for this exam. So easily you can crack this exam. So on an average, basically, we will provide live session. Plus, we record those sessions. If you are practicing, you are not able to attend any miss, or you will miss any live session, yeah, then you will get in that case recorded session. And plus, we will provide you the study materials, and plus we will also provide you a lot of mock tests, a lot of recalls from previous year question paper. This is very easier for you to understand regarding the dentistry in Australia. And this exam is not very tough, especially this part one. You can easily you can crack. And so the 4 month coaching, and in general, if you can give 4 to 5 hours per day for 4 months, you can crack in your first attempt this exam. And next exam is the English proficiency test you need to write. Basically, this might be a IELTS, OET, or PT, any test you can give, but OET and PT is easier compared to IELTS. and you need to go for academic one, IELTS academic or PT academic. And we will also help you to pass this exam. We will provide you the coaching for this English test as well. Okay. So this is the number 3 step. So all these steps you can complete in your home country. Okay. And then the step 4, this is the practical exam, or we also call it OSCE exam. Okay. Or we can say practical exam in simple words. So for this exam, you need to come to Australia to write this exam, and and then you will get a full registration. And if you have any visa and you are already in Australia, then after this exam you pass part 1, you can work in Australia as an assistant dentist or hygienist. You will definitely will get the job in Australia with high pay.
Sorry, sir, could you like repeat the last few? Because my net connection was poor. So can you like repeat?
Yeah, so basically there is a 4-step process. One is the skill assessment, or we can say document verification. Number 1 step, we will help you to complete this step, no need to worry. And next step is the written examination, ADC, Australian Dental Council written examination. And we will provide you the 4-month coaching for this exam. You just need to study around 4 to 5 hours per day for 4 months. You can clear this exam your first time in your home country. And next step, basically the English proficiency test like IELTS, OET, or PT. Any test you can give, but recommended from my side personally, PT or OET is easier for you as compared to IELTS or TOEFL. Okay, so go for this exam, and we need at least 7 individual band in IELTS, or equivalent in PT 65 individual band, or B in OET. These are the scores. Then these are the 3 steps you can complete in your home country. Some country might be not have the exam center. For example, maybe Pakistan not have any center. You have to go to Dubai, or and then Singapore. You can go to write this exam. But India, you have a center, so you can write this exam. Or if you are from Bangladesh, you can travel to India to write this exam. And same for Nepalese. Uh, so this is the fourth step. The 3 step you can complete in your home country. Fourth step is called practical exam or clinical exam, or this is called OSCE exam. Okay, so this exam you need to write in Australia. Okay, and once you pass this exam, then you will get the full registration and you are eligible to work in Australia. So in general, if you already have any visa, for example, you have a spouse visa, or you are on a study visa in Australia, or any other visa. For example, your husband is working, or you are dependent. In that case, you can start working as the assistant dentist in general. Okay, and basically you can start looking a job after part 1. Okay, so sometimes the company can sponsor you the visa to work in Australia. But if not, then you have to go for full registration to pass this ADC part 2 clinical exam. You have to come to Australia to write this exam. We will help you in this as well for you. So English, as I mentioned, you can go for IELTS, OET, or PT, any test you can do. For overall 7 individual band required for the IELTS. IELTS need academic one. Academic, please listen first. There's a 2 type exam, academic or general. So you have to choose academic, IELTS academic or OET. OET I mean only one, and PT also academic. Then you need for assessment
Excuse
is
me,
your
sir. Somebody is speaking. Somebody is unmute right now, so we're not able to listen to you.
Arindam, can you please mute everyone who's
Yes, 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 yes.
I think, yeah. Okay, so I can start again. So skill assessment, we need your degree, whether you did your BDS or MDS or DDS, whatever, your degree and transcript. If you have any work experience, very, very important is here one point. Many students, they finish their degree and they're not working, or they're not working. Basically, there is a gap in their CV. So please don't give any, whatever you just need to work in any clinic or any hospital. that will very good for you for your CV to get a job and register yourself easily. Okay. Otherwise, you have to give the justification why there is a gap in your CV. If you are practicing, very good, perfectly fine. And if not, then they might ask you, why you are not working, at the time. Even there's a 5 6 months. So once you those are in final year student or those are just completed, please start working on any clinic or any hospital wherever you can. Whatever they are paying, that's fine. I mean, you just need to get some experience, clinical experience, easier also for you to get this exam. Okay, this is not mandatory, but if you have, that's good for you. Okay, and valid passport we need, government ID proof.
Sorry, sir, one doubt. So are we looking for like working experience, like the working hours?
I mean, you can ask me this question after this. I'm just going to finish.
Okay, okay.
Firstly, the working hours in general in Australia, full time if you are working, you have to show around 40 hours minimum or 38 hours per week. Okay. But in Australia, this is very, very common. Here, all the students are work part time. So if you are, for example, you are doing BDS or you're doing MDS, simultaneously you want to show your experience. In that case, you can show part time around 20 hours weekly. Okay. And dental registration certificate, most importantly, need and good standing certificate from your council where you are registered dentist. So in this basically, they will ask you around 20 to 80 multiple choice based questions, and there will be around 56 case scenarios, and they will ask you, the around 5 related questions, and maximum hours time for 8 hours, and minimum requirement is great, but in general basically you will finish in this exam like in 4 to 5 hours, and minimum requirement is grade A or B or no negative marking, and we'll provide you coaching for 4 months. And yes,
Excuse me, sir. I'm not getting my screen. Would you please?
anyone else? Arinda, are you getting the screen?
No, sir. I'm just getting that your logo, Academically Global Healthcare, like that logo.
Arinda, it's showing to you?
Yeah, yeah, it's
Yes, sir.
visible. It's visible.
It
It's
is
visible,
visible
sir.
to everyone.
Yes, sir. It's visible.
Okay.
Maybe you can just rejoin back and
Okay, sir.
So basically, once you pass this exam, then you are eligible to apply PR visa, permanent visa. Basically, you can migrate to Australia with your family. Okay, so this is like 190 PR visa, permanent visa. You are eligible to apply, or 491 visa, regional sponsored visa. You are eligible to apply, and these are the work experience, work visa also 484 and for also you are eligible to apply. These are the four visa you are eligible to apply for as a dentist. Yes, on the fees, our team will give you the more information, and we also provide those are the Indian citizens here. We provide financial loan assistance, 3 months, 6 months, 9 months, 12 months without paying any interest rate with the advance. So you can talk to our team for more information regarding this. And right now we are giving the scholarship also, so you can just contact to our team. Uh, Now these are some of the reviews from our students, and now I'm talking to you one on one. Now you can ask me what you have.
Hello, sir.
Yes, please.
Yeah, it's Sumedha this side. I actually wanted to know. So, I am a dental intern right now. Okay,
Hmm.
and I'm not working apart from my college. So,
Hmm.
to be eligible to give exam and after clearing to be eligible to work there, how much is the minimum work experience required? Like, if I start working and like, for
No work
giving.
experience required. No work experience required, as I mentioned. But don't show any gap in the CV. That's what I mean. Okay. If you are just graduate, start working. So if you do not have experience, not a problem. You can start your process. And please like
So
this
for
MedPrep channel. This is basically a dedicated for dentists and medical doctors. So we always uh, create a lot of content interviews from Australia. So you will get a lot of information regarding the ADC exams. Okay. Yes.
Also, I wanted to ask that for the coming ADC exam, when do we need to register? Like, do we need to register 6 months before or something? And like,
As soon as possible. There
what
is
are
no
the
as soon as possible. Basically, you have to start your process. And the exam they conduct only yearly two times, March and September. Okay. So there is no fixed deadline, especially for documentation process. Okay. So for example, if you want to write in March, so at least 4 5 months before you have to start your at least 5 6 months before you have to start applying for your skill assessment. Skill assessment itself may take around up to 2 months.
and sir, what kind of a CV we need? Like, do we need like
CV
for the
does not
stage
need
of
any. Right now, CV does not need it, and CV need after you pass the exam, and we will guide you at a time, CV or cover letter when you are looking a job. उसके time पे अभी नहीं
Oh,
चाहिए.
okay.
Yeah, you need once
Uh,
you pass the exam.
So once we clear the exam, what are the employment opportunities? Like I'm just a BDS graduate. I'm a plain BDS. I'm not MDS or I do not have any specialization. Plus, I do not have any work experience. So as a freshie, if I go there, what are the employment opportunities and how? Like what sort of pay can I
Same
get
for you. I
and
mean, anyone basically in Australia, coming to us, whether you are a BDS or you are a MDS holder, you are basically going to be registration process. So the process for you the same for you. When you are looking a job, obviously those that have experience holder, they will give the first preference for them. Okay. But the problem they are not getting enough dentists. So if you are willing to work in regional areas, definitely you will get the job. In Australia, there is no exploitation. Already the government fixed the minimum wage salaries for all the occupations. Okay. So
sorry,
salary
hear you, sir. I couldn't hear you.
minimum salary government already fixed. So whatever there you will get basically. So as I mentioned, this is like on an average 180,000 I mentioned. Okay. So you will get around maybe 120, 130 when you start working
So
from day
there,
one.
there is no as such requirement for specialization
No, no,
because
no.
I heard
The,
that many doctors, many dentists there prefer graduates from other countries who are specialized in some work
no, no,
or
this is
having.
not. They just need BDS. It is basically they need only the bachelor degree holders. You are just doing for a register. They are not hiring you as a specialist. If you want
Okay,
to be a specialist in Australia, then you have to go for again for their fellowship. Okay, so they are just hiring you as a dentist, simple general dentist. So they just need BDS. There's no role basically. If those already been MDS and they have work experience, obviously they will give the first preference when they are applying the job. The hospital or the clinic might give the first preference to them because they are master degree holder.
okay,
Sir, kindly guide me about the financial aspect of all this process
I
in
mean,
detail.
this is furniture. Our team will give you the more information, but it hardly is. This whole process around 10 to 12,000 Australian dollar.
Sir, as you had mentioned about the four steps of exams, first was the initial skills assessment, comes the ADC exam part one. So this will be held in India, right?
Yes, even English
Okay.
also you can this first three steps you can complete in the home country in India.
Okay. So what is the minimum marks plan like we need to get eligible, like
There is
for OET?
yeah, okay. OET need basically B.
Okay.
Score B.
Overall B grade.
Yeah.
Okay. Then PT and IELTS?
PT is 65 or IELTS 7. This is basically there's a standard uh, 7 individual band in IELTS. An equivalent in PT is 65. An equivalent in OET B.
Okay. Sir, and you have also mentioned about those 20 to 80 MCQs in an exam.
Hmm.
So, which exam is that? Is it the second exam which we have to appear
This
in
is
Australia?
this exam, this is you have to go, multiple settings for this exam. This is not like 1 8-hour exam. Okay? So you have
Okay.
to go for 2 to 3 days this exam. Okay. So like there's a kind of thing, a few questions they will ask you in this, then you have to go next time, then something like 3 days they conduct this exam. You have
So
to
this
go.
Excuse
is
me,
the
sir.
part 2 ADC.
This is part one only.
Part 1 only. Okay, sir.
Yes, we are not
Thank
talking
you.
about part two. It is a clinical. Okay, so there is several
Okay.
stations is there. OSCE exam we call. There is several stations is there, and they will give you some problem, and you have to identify, and they might be asking some small procedure you have to perform, and the lecture is observing your skills.
So okay, sir. So
Excuse
this
me,
is all
sir.
related about the
One by one.
like.
Yes,
So
Sir.
Nisi.
this is related only about the examination for BDS graduates. So now, what about if you want to continue masters in Australia?
Yes, so first you have to dentist, then only you can do master. Anyone can do in India MD. Someone did a Russia or China MBBS, they can do in India in MD, they cannot. First, they have to
Okay.
register themselves as a RMP in India after passing the FMG. So same for you. If you want to do anything in Australia, first you have to register yourself. And
Sir.
Thank you.
tomorrow we have a master class with our faculty. So please join us tomorrow as well. Okay. If you
Sure.
want
Yeah,
Thank you.
to interact with our
sir.
faculty, so you can ask the questions, how we are going to, going to take the classes, about the coaching, and she will also cover one of the topic. So you also can interact for tomorrow.
Sir, can you please repeat the visa process? I'm a bit confused.
Can we allow others to talk? Huh? I think she's only going on asking. Others also want to talk. Huh? Others also want having some questions.
Yes,
Just
yes, yes, sure, sir. I'm
not
here. No worries.
limited to some 2, 3, 4 of it is enough now. You have to give chance to others. Going on asking please 20, 30 questions.
Yeah,
No,
no,
I
Yes,
want.
please. There
sir,
should be a pattern.
No,
sir,
I want. No, no. On behalf of my daughter, I'm asking her. December she's complete. She's doing Savita Dental College. By December she's completing his internship. Can we register now?
Yes, I mean, she only can give the exam once she registered as a dentist in India. Okay.
Okay,
So,
okay.
but she can join the coaching, our coaching, she can join, but she
Okay.
only can write the exam once she get the registration done in India. Then only we can start the process.
Oh, that's what I. So during internship they cannot register.
No,
When it
no,
comes to
no, no, no,
completion. Okay,
no.
okay. Because December
Thank you.
only she's completing. That means
Yes,
after only I can do it. Then we have to
yes,
attend on March. March exam. March
yes.
exam she can attend. December only she's.
I mean, I don't think so. She can apply for March because
Oh,
she has to now the pass the degree and then she has
oh,
to apply for
apply all
uh,
the
dental
September.
registration in India. So most likely your daughter can go for September one.
September
Okay,
only.
sir?
Then B grade
Sir,
you
I
are
think
B grade
Sir,
what
please.
Yes, I'm here.
Sir,
Yeah.
please, I have a question.
Anna, please, one by one. I
Last
mean,
question. B grade what is
Sir,
the
this is
mark?
my first.
You are telling B grade what is the mark? The B grade means mark. You know, 60 to 70 or 70 to 80 or what is that?
okay. I mean, there is no categorization. ADC is not given such
Okay.
criteria. They are just mentioning A and B. If you got the grade, and you will pass this exam. And they are
Okay.
sir,
giving
ADC.
A, B, C the grade based on the performance in that exam.
Okay.
The highest mark, the lowest mark. So based on that,
Okay.
they will make the
Never mind.
A, B, C. So if you got A and B, you will pass. And if you got C, and you have to repeat the exam.
Oh, okay. Thank you. Thank you.
Thank you so much. Hi, Kanath. Yes.
Sir, please repeat the visa process. I'm confused a bit.
I did not mention anything about this. I mentioned if you pass the exam, then you are eligible to apply PR visa. That's
Sir,
it.
this ADC exam is not happening in Pakistan, I think.
Yes. So you have
It's
to go
only
to
in India.
Dubai or Singapore.
Okay, okay.
So this exam basically, in very few countries, I can say in India we have centers, but Pakistan, Nepal, Bangladesh do not have any centers. You have to come to India or maybe Dubai or Singapore as exam centers.
So that's extra difficult for us. Okay.
Thank you.
Thank you.
So,
Saudi
for this
Arabia, is there any center?
so for this master class that is for tomorrow, when do
Yeah.
we register?
Now we will send you basically. You guys, if you want to attend webinar tomorrow, master class, so please leave your name or WhatsApp number, including the.
Sir, I've already added the link, on the chat as well.
Okay, so guys, there's a link for this.
I've added the link of the class on the chat itself. You can save the link from there itself. The Google Meet link.
And we
right
will
now
also
I'm sharing it. See.
Yes. Yes.
Hi, sir.
Yes. Hi.
Sir, I have a doubt. If after registration, is it possible to start practice there? Is BDS is BDS approved there in Australia, or should we take any other course?
No. BDS is enough. You can practice once you pass the exam.
Okay, sir. Thank you.
Sir, can you please tell about the master's courses available after getting registered there?
I mean, same like in India, if you are doing any MDS, so similar you can do here. All the specializations are available here. So most likely, there is a clinical and non-clinical courses. So if you want to do any non-clinical course, no need to do for registration, but you will most likely will not get the job or very difficult to get a job or a visa. But if you are going for ADC and become a registered dentist here, you can get the PR and job. And once you registered, then you can appear, and you're on, a lot of branches basically in dentistry. University of Sydney, one of the top university in Australia. You can go and have a look at their website. So there is a lot of and the master courses are available.
Hello, sir.
Yes, Dr. Megha.
Hello, sir. I am Dr. Megha. I'm a periodontist. So what I want to know is if I clear my part 1 exam, so can I work there or how is it like? How can I specialize myself later?
Basically, once you pass ADC 1, so you have to find a job. So when the company has to sponsor you the visa, then you can start working there. Okay. And otherwise you have to pass ADC 2, and then you can apply the PR visa. Okay.
So if I clear my ADC 2 also, so can I work as a pediatric dentist there?
No, you will be a general dentist. Now you want to do some specialization in if you want to practice any.
Okay, sir. Thank you.
Pediatric specialization, if you want to do, you have to go again specialization here in Australia.
Okay, so how many years is that course, sir? So I have to specialize.
Basically, here if you are doing any PG you are doing, you will get the paid salary. So this is not free. Okay, first of all, and this is around 3 to 6 years based on the which branch you got.
Okay, sir. Thank you, sir.
Yes, please.
Yes. Can I ask you some advice on the preparation of the part 1 of the exam, please?
Yeah. I mean, for preparation, you can attend tomorrow is the live class we are sharing here. This is the ADC master class. Tomorrow is the free class, so you can attend that. So you can basically observe our teaching on this topic.
Okay, thank you.
Thank you. So tomorrow is our faculties here, so you can ask if you have any specific questions regarding the preparation and all those things.
Hello, sir.
Yes.
I am from Somalia, living in Somalia. How can I get for this exam?
Okay, you are from Somalia, right? So,
yes.
Arindam, do you have any idea in African where is the exam center?
So nearby is South Africa and Ghana. They too have they have the Pearson centers over there.
Okay, how I get for this process?
Yeah, this process we will help you to complete. But for exams, you need to go to another country to write this exam. So in your home country, there is no exam center. So you have to go to.
It's only South Africa or Ghana with Ethiopia and space.
Basically, you also can check yourself with ADC website. Where is the exam center? Okay, so as as I mentioned, that these are the exam centers available basically.
Okay. And at which month for this exam is began?
March and September, yearly 2 times they conduct this exam.
March in 2024.
Yes, every year, March and September, yearly 2 times you can write this exam.
Okay, thanks. Can I go to Dubai to participate of this exam? Dubai?
Yes, next please.
Can
Hello,
I,
sir.
if I go to Dubai?
Yes, Dubai you can go.
Sir,
Hi,
can
sir.
we apply
Can
for clinical masters without the ADC exam?
No.
No, only basic science.
Yes. For any clinical branch, you must be a registered dentist in Australia.
Okay.
sir, can you told me the exact process of ADC registration?
That's what I was told. This is the actual process. First, the document verification, then ADC Part 1 exam, then English, then ADC Part 2, then you will register as you will get the full registration in Australia.
And what's the cost of that whole process?
Around 10 to 14,000 Australian dollar.
Hello, sir. Good
Okay.
evening.
Regarding the
Sir,
cost,
only one
but
question,
we'll
sir.
give you the
Hello.
more information one-on-one, in step-by-step process. You can ask
Hello,
Okay,
your
sir.
okay,
team. Yes,
okay.
Hello, sir. One question.
yes, please.
Hello.
Yes,
What is the minimum percentage in our undergraduation? Is there any like that
there is no such
criteria?
criteria. There is no such criteria. You just want to
Okay,
check
okay.
you must be a pass the degree. That's it.
Yeah.
Even someone is failed and they pass in second attempt, third attempt, doesn't matter.
So then if I after passing ADC, if I move to Australia, what type of job I will get? Because
Dentist,
my
you are doing
fiancée, my
dentistry
girl is
only.
from Australia only, so I can easily move to Australia.
You are doing
Well,
registration for dentistry only, so you are going to work as a dentist only.
okay, after completing part two only, I can work as a dentist. Right? After part one, I cannot work.
No, partner, you can work as an assistant. You are
Assistant.
not getting any full registration. How you can work?
Yeah, yeah. Okay.
Yeah,
Thank
you
you, sir.
can work as a assistant, dentist, or
Assistant
hygiene,
means what assistant? Dental assistant means what type of job?
dental assistant. You have to assist a dentist.
Sister, just like
Yes,
a dental nurse.
yes. Dental nurse, we
Okay,
can
okay,
say, kind of.
okay. Thank you, sir.
Thank you.
Okay,
Good
sir,
evening.
can I ask you
Excuse me,
a
sir.
question?
Yes, Amrita.
Sir. Good evening, sir.
Good evening.
Sir, what are the odds of us getting? What are the odds of us clearing the ADC Part 2 examination, sir? Is
Uh,
it okay, or should we take any coaching regarding the practical sessions?
Definitely, you need coaching. Your
So, will you provide that coaching, sir?
yes, we will provide. Yes. So in
So,
general, basically in Australia, there is a main problem in Indian uh, medical education. There is no OSCE, whether it is a MPS or pharmacy,
hmm.
dental, nursing. But in Australia, any healthcare professional want to register here, they have to go to OSCE exam. So for
Okay,
that, you need training because in our syllabus that is not covered in India.
okay, sir. Sir, will
Okay,
it
sir.
be
Yes, Amrita.
sir? Will it be more precise than what we have learned here? I've heard that it is very tough. So, uh,
Yes, basically, this is here most likely you have to understand that there is a lot of guidelines need to follow when you are practicing in Australia. So, whatever we are doing in India, so this little bit, the change in the practice and
yes, sir,
guidelines.
yes, sir.
So that's why a little bit tough this exam. Otherwise,
Okay,
they
sir.
will ask you the question from this BDS only. What about the syllabus? They're not going to ask something else. And
Yes,
we
sir.
are basically here. So last 15 years, based on question papers, we have prepared our own
Okay, sir.
the material.
Okay,
So it's very easy for you because we are providing other healthcare professionals exam like AMC,
sir.
CAP. We have around 90 plus percentage the passing record so far.
Okay. So you'll provide the practical coaching too, no, sir?
Yes, once you pass part one.
Okay, sir. Thank you.
Yes, next please. Sharjil.
Okay, and sir, and for this exam, it's free or it's taking money?
Nothing is free. Who is
Fee.
going? Why they have to actually have to take a free of cost the exam? There is a fees, government
Okay.
fees separately, and our fees as well. We are providing the coaching from Australia. So as I mentioned
Okay,
here,
you
you are going to earn like $200,000 Australian per year if you are marketing to Australia. So obviously, this is a very uh, little amount I can say you are going to invest in the whole process.
okay.
Sir, if I'm
At which
Yes, Nancy.
if I'm giving the exam on March 25, but if I'm starting the coaching now, will I get that coaching till I give my exam, or
This is too early. When you are going to graduate, basically.
my final year is just over and I'm an intern now in KLE Dental College, Bangalore. So I have my internship till September, next September 2024.
And then you have to register yourself as a dentist.
Yes.
Okay. Yeah. Okay. Arindam, please talk to her separately.
Okay, okay,
Yeah,
I'll do that.
Arindam will talk to you. Okay, after this conversation, maybe not tomorrow morning. Yes. Next, please.
How many
Hello,
Kavin.
sir.
Kavin Shrestha.
Yes, sir. What is the gap between part one and part two?
There is no such gap required, but at least recommended minimum 3 months.
Sir, if we clear the part two exam, then we should repeat from part one or what?
Uh, uh, you have to pass part two within 3 years. If you are not able to pass this exam, so if you are not able to pass within 3 years, then you have to repeat. You need to repeat the exam.
So until 3 years, we can work as assistant dentist. Yeah.
Yes. Um, if you basically you have to pass it part two as soon as possible. I'm telling you, if you are not able to pass, if you are failed 6, 8 times, then you have to you need to repeat.
Okay, sir. Thank you.
Sir, Assalamu alaikum.
Yes, one Sam.
Sir, I am Dr. Shajil from Pakistan.
Okay.
I have a question. I want to practice in Australia. I have graduated in 2021.
Oh, okay.
So, sir, please kindly guide me. How can I get access to Australia to for a general dental practitioner?
अभी तो ये बताया था मेरे भाई, 1 घंटे से यही बता रहे कि 4 स्टेप
Sir,
अच्छा
yes.
4 स्टेप करने होते हैं बेसिकली। डॉक्यूमेंट वेरिफिकेशन, फिर एडीसी का पार्ट 1 एग्जाम, फिर इंग्लिश का एग्जाम, फिर एडीसी 2 का एग्जाम, then you will register as a dentist in Australia. There are 4 steps.
How much it cost?
Cost basically you have to pay 90, 70, 80% cost to the government directly. So cost is very, very low basically, around maybe $12,000 something.
Okay. Thank you.
So, how many attempts we get for ADC part 1?
There is no such, you can as many you can.
Okay, thank you.
Sir, do you also provide guidance about other exams like UK or Canada dental
Uh,
license exams?
yes, we are working, but not yet.
Or
It's
there
not,
will be separate sessions?
yes, for that.
After clearing ADC, it is applicable in Australia and it is also applicable in any other country, or is it Australia only?
For Australia, so each country have their own exam. Even if you
But
want,
like countries like New Zealand and all, it's not applicable.
Australia, New Zealand is the same country. This is like they recognize each other basically a culture. So
Okay.
if you
Is there any other country which recognizes ADC?
no, these two countries,
Canada and all are not included.
no. Each country is their own exam. Even a small country like Dubai, you have to write the DHA exam. If you want to work in Saudi Arabia, prepared MOH exam. I mean, this Gulf country required this kind of exam. Even India required this exam, So each country has their own exam. Wherever you want to practice, the exam only applicable for that country only.
Yeah, fair enough. Thank you, sir.
Thank you.
Sir, that is what I was saying. Do you provide guidance about any of these other exams
Yes,
as
yes,
well?
we provide. I think the separate session for that. So today is for basically ADC, but we are working basically for Canada. But the problem, the Australia is the easiest pathway to get a visa basically.
Hello,
Yes,
sir. Dr. Dinraj Kulkarni here.
yes, Kukarni.
Sir, I just wanted to ask you, we have a two parts, right? Part one and part two
Yes,
exams. So,
yes.
of which, if at all I can clear, I can able to clear the part one only.
Hmm.
Then, are there any opportunities in the initial stages? Because if I go there and after that I can clear my second part, then
Basically, once you pass part one, you can start looking a job in Australia. Okay.
okay. So we'll get a job over there after
Yes,
that.
and then you have to come to Australia, and then you can work here, and simultaneously you can write part two. Okay,
Okay.
and
Okay.
many people what they do, many people they come on study visa. They come on like a very short course, kind of like 1 year course or something, and simultaneously they study and they pass part two exam and they work part time. So whatever if you are working as a part time, you will get at least enough money to survive yourself.
Okay, okay. So does mean that if I can able to clear my first part, then I'll be able to work over there then.
Yes, anyone. I mean, you can work as an assistant dentist, but you
Acha.
need visa for working. So if someone is
Okay.
given,
Mhm. So if any person is there, any my relatives are there, then they'll give the visa.
yes, if they have any dentistry company, they can.
Okay, okay,
If they have
okay, okay,
any
okay.
dental clinic, dental hospital, the company has to sponsor you with a not individual
Okay. So does mean that someone should be sponsoring then and there only I'll get a visa,
work visa. Yes,
work
but
visa.
but if
Okay.
you pass part two, you can apply PR visa. Then for
So
that,
how will you help us over there? No, after clearing my first exam, will you be able to help us to get a job over there?
no, we are not an agent. We are not charging you anything. We are only charging you the course what we are providing. Our job to help you crack the exam. Okay. We are not
Okay.
charging to anyone anything else, but we
Okay.
provide the guidance how you can start looking a job, your CV, cover letter, what kind of question they may ask in the interviews, what are the websites here you have to start looking a job, or what are the agencies here they help in the job. All those guidance
Okay.
we will give you free of cost.
Okay. 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 Fine, sir. Thank you so much.
Thank you.
Sir, I have a question.
Yes.
I am Farzana from Pakistan, final year BTS, and I was about to ask that can we join it? Can we give the exam for ADC just after our final exam, or we have to do house job? Then, do we need any experience, clinical experience
Registration,
after the house job?
you must be a registered dentist in your home country. This is a condition.
Okay.
So this only you can get your after your houseman job, right?
Mm-hmm. Then, do we need any clinical experience, like any going to any clinic, or can
Yes.
we just write after house job we can apply?
Yes. Once you got your registration, you can write straight away.
Okay, thank you, sir.
Hello, sir. I'm Dr. Roshrin from Nepal. Can you please explain about the ADC Part 2?
What was a clinical exam? So they will give you some case or some scenarios. They might check your skills. So all those things. This is a kind of, there is several stations is there, and they will see the skills. This is the clinical exam, practical exam basically. OSCE
Yes,
exam.
sir. Okay, sir, but will we get to practice those clinical exams, clinical practical exams before we give the main exam? Like,
Yes, you have to go for coaching for that, or you have to study yourself for part two separately for OSCE exam for dentistry.
So do you provide those
Yes,
coaching
once you
classes for
pass,
part two also?
yes, once you pass part one, we will provide part two as well.
And so so we have to come to Australia for that.
Most likely, we will try the online half, or half might be in Australia, or we may set up in India. We are working basically in the Delhi NCR. We
Yes,
might
sir.
basically the main problem, we are not getting the enough number of applicant. If there is a two applicant in India, we cannot set up in India a clinic for them. So if we get
Sir,
like
but
20,
I am from Nepal, sir. Far
so I
from
told you,
India.
in Nepal, nothing. Even you don't have any exam centers. Even I'm talking in India, we are not getting enough applicants. We have 140 crore population, 1.4 billion. Still, people are not much interested in this exam. So we are not getting. If we got enough applicants, we may offer in India. Otherwise, you have to come to Australia.
For
So
the
I'm speaking from Delhi, India itself. I wanted to know if you have any center which I can visit for offline coaching or something like that.
There's no offline. There's not a single candidate from Delhi. So how we can open a center there? Yes, this is हमारा coaching center है online. Okay, we have our mobile application. This is basically we are a ad tech. You might be know in India like An Academy और Byju's. तो ऐसे ही हमारा है. तो हमारा मोबाइल एप्लीकेशन है. आपको क्लास करनी होगी. फिजिकल सेंटर खोलना बहुत ही डिफिकल्ट रहता है. बच्चे मिलते नहीं है ऐसे एग्जाम के अंदर.
And can I get to know which all books we have to refer
We
particularly?
cover A to Z in our yeah, in our classes. So you no need to buy any additional book. If you need, we will give you all the material.
But there are some books enlisted on the ADC website. So
Oh yeah, so you have to study yourself. Then there is no need for us.
and that will be covered under the cost you are charging for the course.
Yes, we basically our syllabus based on like if you are going at ADC books, so it might take maybe 1 or 2 years to study and give the exam. Okay, but our course might be 3 to 4 months. We just
And you will provide the hard copy of the notes or like the soft copy.
online copy. Everything is offline. I mean online. Sorry. Then you have to make your own notes.
And
We give
tests and all will be there. Like, will we get the percentile? Because the ADC works on percentile method.
Yes,
So,
everything will be there. Basically, we will take live session, live class, plus we'll give the study material or plus the mock test. The mock test will be in the percentile base.
thank you so much.
Thank you. Yes, next please. Ishadev.
Hello, sir.
Yes.
Insaf here. Is this language exam is mandatory?
Yes. You want to work in Australia as an English speaking country. आपको बोलने नहीं आएगा तो क्या करोगे यहाँ से? Mandatory. This is any healthcare professional want to come to Australia and then अगर कोई मजदूरी नहीं करेगा तो समझ में नहीं आएगा तो क्या करेगा वो, है ना? तो इंग्लिश तो मैंडेटरी है यहाँ पर ऑस्ट्रेलिया.
Okay, okay. Thank you, sir.
Yes, next please. Or maybe you can join tomorrow is the ADC master class with our faculty. So the link already be given you in the chat box. Or if you can leave us your phone number, emails, we will send you the invite so you can join tomorrow as well.
So just wanted to add, I think most of the people who have joined today, they have received this link on WhatsApp. So just ping a hi on the same WhatsApp number. You will get the link for the masterclass over there as well.
Yes. So basically आपको ये link मिला होगा WhatsApp के through. So you just send the back the hi or reply to that WhatsApp. Our team will give you for tomorrow link as well. Yes, किसी को कोई क्वेश्चन है? Last one or two.
I would want to know the cost of the coaching you are going to provide, and if I already have a IELTS score, I just want to know the part one coaching. Rest I have like other things figured out. Only the part one theory coaching.
Yes, the
What
coaching
are
will, Arindam will get back to you. Arindam, please
Yes, yes.
contact Simon.
Yeah. Nitya, I believe you got this link on WhatsApp, if I'm not wrong. Is it so?
Yeah, yeah. Yeah,
Just
yeah.
reply a hi on that same number.
Okay, sure.
Just reply a hi and your question on the same number. You will get a reply and a detailed answer to your question.
Okay, thank you.
You're welcome.
Hello, Assalamu alaikum.
Yes, welcome.
Sir, I'm from Pakistan. I want to confirm that whether I have to go to Dubai or any other country for passing or for giving ADC Part 1.
Yes, basically in your country there is no exam center. तो obviously आपको कहीं दूसरी कंट्री में जाके ही देना होगा. तो दुबई में सेंटर है इसका या सिंगापुर में है, या ऑस्ट्रेलिया भी आप आ सकते हो.
Okay. Okay, sir. I want to reconfirm that after passing ADC Part 1, you are going to work as a dental assistant in Australia.
मैंने बताया इवन इफ यू आर नॉट राइट द एडीसी वन, आपके पास अगर वीजा है स्टिल यू कैन वर्क एज असिस्टेंट डेंटिस्ट. ठीक है, तो वो कोई इतना बड़ा वो नहीं है आप असिस्टेंट की जॉब करो. यू आर नॉट ए डेंटिस्ट. डेंटिस्ट आप तभी बनोगे जब आप एडीसी 2 पास कर लोगे, तभी आपको फुल रजिस्ट्रेशन मिलेगा. एडीसी पार्ट 1 के बाद में आपको पार्शियल रजिस्ट्रेशन मिल जाती है. जितने भी ओवरसीज क्वालिफाइड होते हैं वो लोग प्रैक्टिस कर सकते हैं, किसी के सुपरविजन में वो लोग वर्क करते हैं यहाँ पर. तो बहुत सारे लोग फॉर एग्जाम्पल अगर आप स्टडी वीजा पे आते हो यहाँ पर, तो आप पार्ट टाइम आप जॉब कर सकते हो एज असिस्टेंट डेंटिस्ट. साइमल्टेनियसली यू कैन प्रिपेयर योरसेल्फ फॉर पार्ट 2.
सर, ये असिस्टेंट डेंटिस्ट की जो जॉब है वो पेड होगी और ये आप कैसे अप्लाई?
नथिंग इज फ्री इन ऑस्ट्रेलिया, एवरीथिंग इज पेड. तो आप कुछ भी करोगे आपको पैसे अच्छे खासे मिलते हैं. मैं सिंपल बताऊं तो यहाँ पर बच्चे खाना जो बांटते हैं ना उबर ईट के ऊपर, वो भी $30 पर आवर कमा लेते हैं. जो चपरासी या चौकीदार होता है उसको $30 यहाँ पर मिलते हैं. तो डेंटिस्ट को ऑब्वियसली ज्यादा ही मिलेंगे असिस्टेंट को. यहाँ पर पैसे का प्रॉब्लम नहीं है ऑस्ट्रेलिया में. गवर्नमेंट ने ऑलरेडी फिक्स किया हुआ, मैंने बताया. तो कोई भी उससे कम कोई देगा नहीं आपको पैसे. वो देगा तो कंपनी बंद हो जाएगी, वो जेल में चला जाएगा, है ना. ऑस्ट्रेलिया के रूल्स रेगुलेशन बहुत टाइट है यहाँ पर. तो मनी का कोई ऐसा एक्सप्लॉयटेशन नहीं है. आप जब भी आप आओगे आपको अच्छे पैसे यहाँ मिलते हैं. $40, $50, $45 ऐसे मिल जाते हैं पर आवर की बेस पे एज ए डेंटल असिस्टेंट पर ही.
तो सर, एडीसी पार्ट 1 क्लियर करने के बाद आप कैसे अप्लाई करेंगे फॉर एन असिस्टेंट डेंटिस्ट? उसका क्या आपको जॉब आएगी, आप उधर अप्लाई करेंगे या क्या उसका
अप्लाई करोगे? बेसिकली आपको पार्ट 2 देना है. सिंपल सा बात ये है. पार्ट 2 पास को तभी आप डेंटिस्ट बनोगे. अब आपको जॉब मिले या नहीं मिले, पार्ट 2 तो करना ही है आपको. तो अगर जॉब मिल जाती है तो आप पार्ट 1 के बाद आओगे, नहीं मिलती है तो फिर आप पार्ट 2 आपको करना ही करना है.
ओके. ओके सर, थैंक यू सो मच.
हाँ, तो आई थिंक वी कैन रैप अप हियर.
So one last
Good evening, sir.
question. Where are the centers in Australia for part 2 and where are the centers for part 1 in India?
There's so many centers you can find on Google. I mean, Arindam can give you them once. Arindam, where is the center basically? In Delhi, Mumbai,
Delhi,
I
we
think,
have Hyderabad, we have
Pune, Hyderabad. There's 5 exam centers in India.
Nitya, what you can do is now you can just share your location first, and we will try to track the nearest one for you.
In Delhi, as I told you, Delhi NCR.
Yeah, Delhi mein we have it. I think you are connected to Nasreen, right? So just I think just drop in your location and we will give you the exact nearest.
And what about the Australian centers? Is it in all cities or is it in some particular cities only?
Some particular cities.
Like any example?
These exams are not very common. It might be in Sydney, maybe one center is enough. This is not like hundreds, thousands of people are coming to write this exam. So they might be have Sydney, Melbourne, So the major cities, they have the exam centers.
We can practice in any city.
Yes.
Okay.
I think, sir, there was one final question from somebody who was asking it, and then we can wrap up. Anybody who was asking the question?
Good evening, sir. My name is Athar, and I have completed my internship this month from Nijlingappa Dental College, Gulbarga.
Okay.
सर अभी आपने कहा था कि मार्च में और सितंबर में 2 अटेम्प्ट्स रहेंगे एग्जाम के लिए, तो मेरे लिए कौन सा बेहतर होगा सर, मार्च वाला या सितंबर वाला सर?
एज सुन एज पॉसिबल होता है ना, आपको तो अप्लाई कर देना है। हमारा तो कोचिंग 4 मंथ का ही है आपके लिए, ठीक है।
ओके 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 सर।
तो आप अभी इंटर्नशिप करो, फिर आपको रजिस्ट्रेशन के बाद ही आप अप्लाई कर पाओगे, जब आपका रजिस्ट्रेशन हो जाएगा।
ओके 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 सर, ओके सर, थैंक यू।
गाइस, आई विल सी यू बेसिकली हैव मास्टर क्लास, तो आप लोग कल ज्वाइन कर सकते हो हमारे लिए। ये टाइम ऑलरेडी दिया हुआ है यहाँ पर।
Guys, I've already copied the link on the chat as well. आप chat से वो link copy कर सकते हो. Alternatively, just reply a hi on the number who has shared this link with you. He or she will also provide you the link. ठीक है? For tomorrow's live class, the master class. Our faculty will be there to take a class with you. Thank you, sir. Thank you. I think so we can wrap up.
Thank you.
Thank you, sir. Thank you so much.
Thank you.
We'll see you tomorrow, guys. Okay, bye.
Bye.